And I'm switching tubes. These little doohickers here, little lips here, they're very handy. Very handy. So I will have 2 fingers on it, like so, and I will touch my patient. I'll hold them down, and that can be an anchor itself already. By holding the skin tight, that's going to cause a very smooth entrance. Another thing about elderly patients, their skin isn't super tight, isn't super elastic. So a lot of times, even if their vein is great, I will anchor below and above, just to stretch that skin out, make it tighter so it's less likely to cause pain. Smoother entrance, all of that. It's kind of a feel thing after you get it. But switching tubes, I will usually lock and load, that's my term. It will not be, because I don't want to puncture this, it will not be pushed up against it, but I will be holding it. So I'll have 2 fingers holding it in place and pressing it against the hub to keep it in place, so I'm not going to drop it or it's not going to go in when I don't want it to. Because if you do puncture it on the way in, that's going to cause a suction, and that's going to cause pain. Sometimes it doesn't, most times it does, because that suction is going to suck on all the interstitial fluids, all the different tissues that it's going through on its way to the vein. And the same thing with pulling out tube. You want to make sure the tube is off of that inner needle before you pull it out, because it's just going to be sucking all that stuff in there. And it could also compromise the sample itself. Yeah. So when I push in, and I have the needle in the arm, I'm not going to poke it right now, but I will be holding tight to the fingers that are on the skin. I'm going to be holding down. I mean, that's pressure. Yeah. That's good pressure, right? Yeah. That's not going to hurt her. It also gives me a feel for how she's moving. Is she moving back and forth? Is she moving side to side? This is also why I have a pinky. I have my pinky out. I'm sipping tea. I got my pinky out, and I'm holding on to the arm over here. Idea. So, and my boss actually taught me that. And I'm like, oh, that's great. Yeah, that's a great tip. So if she's moving, it's less likely that that needle is going to injure her or come out or cause more damage in the arm if I'm moving with her. So that's a stability thing. Pressing down is a stability thing. Holding the tube in there with my extra finger is a stability thing. So when you're pushing in, this is why I have my left hand as my doer, I guess you would. This is my stability, this is my doer. Just for pushing in sake, I will demonstrate. Pull this way with this finger and push in on the tube itself while using this finger to control it. Because it's going to be all over the place if you're not holding on to it. So you're pulling it together at the same rate. Some people, if you don't have the feel for that, it may seem like, oh, that's kind of a stupid thing to say. Duh, you're going to be pushing it in, right? Well, some people are pushing it in, and the whole needle's going with it. Right, yes. And then they're up to their gills and and guts, right? And you're going through it. That's no good. Yeah, pretty much, you can get an arrow on the other side. It's no good. So it's in there. It's on the needle. It's usually not going to pop off. So at that point, if you're having stability issues and you need to let go of the actual tube, you're good. You want to make sure you're controlling this area around the needle. At that point, if we have had tubes that were damaged and it would pop off. It would just pop off because there was nothing in there, and some kind of situation was going on. It would pop off. We have had it where it wasn't on there all the way, and you're like, oh, I'm not getting anything. Okay, we'll push it in a little further.
Right, and there it is.
Boop, there it goes. And it just kind of, and I'm like, oh, okay.
One of the things I do when I do this is, if I only need 2 tubes, like say one serum, one lavender, I'll bring out an extra serum and an extra lavender, and I'll have them close by so I'm not reaching for anything.
Right.
Because if I have a bad tube,
yeah, you never know. Especially with the larger ones, the glass ones, the red tops. A lot of those, you can get them in plastic, but a lot of times they're glass. At least at the lab. If they roll off, without your stuff nearby, that's a really good trick. Have it in your pocket, or have it in you can get clamp-on things for chairs. Put your extra tubes in there and whatnot. If I'm not going to be close to stuff, I also do that, like nursing homes and whatnot. You never know where you're going to put your tray. And you never know where you're going to end up with wherever you're drawing and stuff. So that's a very good point. Most of the time, I will have all of my tubes within reach. So if there is some kind of conundrum or it's not working, my first thing is switch out the tube. Maybe the tube is damaged, and then maybe just the thing that you need. Since that one's used.
I'll take that.
Okay.
I don't want to mix it up with the good one.
Okay. Since that one is cooked. Pardon me?
Sometimes I didn't realize you could actually you pushed the vacuum container tube in the needle, the sheet needle.
Yes.
You want to try it, see how it feels?
No, not pushed, that was just.
No, that was just a demo.
That was just a demo.
Okay.
Yeah, she said, don't do that.
Yeah, don't do that.
So, yeah, my
No,
lock,
she
my
just
lock and
wanted
load.
to show the lips and
Yeah.
how to anchor it and
Yes,
put it on there and
the actual
pinching
motion.
it together.
Because we will have somebody who will just push on the edge, and
Right.
the whole
And then
assembly
push
goes
the
further
needle
into
in.
the arm.
Yeah, use the anchor.
Yeah, so you just have that closing at the same rate motion, and try to keep it as stable as possible. And when you're pulling out, which it'll be in, and you're in the arm, you're anchoring, I will use both fingers, or one or two, depending on how many tubes I have in this hand. You can get quite dexterous and just kind of and rotate all the tubes in your hand. Have a couple fingers push up against the hub so that it has something to stop, and you know where it's at. Use the lip. Pull out with these two and push against with your thumb, and it's a lot smoother that way. You're not oops, the needle's out of the arm. That's happened, or somebody jerks
either
back.
way.
I have somebody assist me with the removal of their needle and pulled their arm back. I'm like, all right, you're okay, puddles, okay. That's no good. Yeah. And that was no good. So, all right. Well, why not? Let's just poke
Yeah.
it, okay?
Go for it.
So I've done my visual. I've done my pre-tourniquet touch. Yep, for sure. That's a good one. Tight, nice and tight. And that's another trick too. Some people don't get the tying.
Oh, yes. Yeah.
What's really handy is if she had a really long sleeve,
Right. Short sleeve.
I could tie that over it. And I pull this one tight. And so I'm going to get it really tight just for demo sake. Pull this one really tight, up, over, tuck it in. And that's super tight. I wouldn't tie
It is super tight.
boom, let it go. But that's the quick release. That's, if you ever have to tie up a horse, boom, quick release for that. But if they have sensitive, nay.
Yeah, oh,
Yeah.
nee, that's right.
Anyway, sorry about that. I'm beating you up.
Right.
Okay.
That's okay, I'm all right.
Okay.
I asked for it. It's okay.
Okay. So that's something that you can get used to. But if you had it over the sleeve and you had a sleeve below it, you can just flip the sleeve over it, and that'll keep it out your way.
That's a good idea.
And it's out your clean zone and all that. Especially if you're doing a blood culture, you need to, you're never going to be sterile with that situation, but you need it as clean as possible. So I'm palpating. I'm cleaning. Getting my stuff all set up.